Well, each year, almost 40 million people suffer from sinus infections. Dr. Marc Kerner is an ear, nose, and throat surgeon with Cal West Head and Neck Surgical Institute. He is here to help us find some relief. Good morning, doctor. Thank you so much for being here. We appreciate your time.
Great. Thank you for having me.
Well, I just have to ask because I just went through this. I had a really bad cold that wouldn't go away. The pressure was really bad. What's the difference between a sinus infection and a really bad head cold?
Sure, that's a great question, and it's something that we use as an arbitrary definition because many of the symptoms overlap. So a cold and a sinus infection have the same symptoms, whether it's a runny nose, facial pain and pressure, congestion. So we typically say that a cold that seems to last more than 7 days is a sinus infection, and at that point we think we should be treating them with antibiotics.
And not to get too gross on morning television here, but sometimes you can tell what the sinus infection is by what's coming out, right?
Absolutely, and that's another great indicator as well.
Okay, and so we also hear a lot of people complaining about allergies.
Sure.
So how do you differentiate then between those and that?
Sure. So typically allergies, people that suffer from allergies have allergies over a long period of time, and they get worse seasonally. So their symptoms will be anywhere from itchy eyes, maybe a little bit of a runny nose, some congestion that's intermittent and usually occurs at different seasonal changes. And what can happen is when they have bad allergies, it can cause swelling and it can cause blockage of the sinuses, which then leads to a sinus infection.
Okay, and of course we know with a true sinus infection, you should probably be taking antibiotics, but now I feel like doctors are maybe scaling back. They used to overprescribe antibiotics.
True, and I think it's very hard to differentiate whether it's a viral cause, such as a cold, which we consider to be a viral etiology, versus a bacterial infection, where sinus infections then are usually caused by a bacterial infection, and they can occur together too. So a lot of times the differentiation is difficult for doctors, and unless you can look into the openings of the sinuses like we can with our technologies, then it's hard to make the diagnosis.
Right, which the normal doctor can't do.
Exactly.
Usually, right. So if someone is having persistent, chronic sinus problems, we've heard about sinus surgeries, but what's kind of the latest in technology for people who are having true, genuine sinus issues?
Sure. So we always start with all the conservative measures. So the best things are saline irrigations, and actually
the neti pot,
exactly, either the neti pot or
like
bulb, syringe, or irrigations, where you're cleaning out those sinus cavities and getting those allergens and those things that are triggering these events out of your nose.
My dad does that 2 times a day, morning and night, every day.
And it's fabulous, and we try to get everybody doing that because it is very, very helpful. So when they fail those measures, or you're having repeated infections, then we have to look for anatomic reasons why they're getting the sinus infections, whether it's a septal deviation or it's blockage of the sinuses from nasal polyps. So there's a number of reasons, and those things then we can evaluate with a combination of looking right directly into the sinuses with endoscopes and then getting a CAT scan, which can delineate the exact cause of the disease.
Okay, and if you do have to have surgery, is that still something that you guys are doing?
Sure, we do, but now we've got newer technologies. We actually have a much more minimally invasive technology called balloon sinuplasty, which is basically taken from angioplasty, where instead of dilating a blood vessel like a coronary artery, we can actually open those small sinus cavities and the openings with a balloon, because it's that blockage which is what's causing the infections. So if we can enlarge that opening, then when you get a cold or you have an allergy flare-up, it doesn't block off, and now it drains properly.
Wow. Fascinating. Yeah. Thank you so much, Doctor.
You're
we
very
appreciate
welcome.
your time, and we hope everyone has a healthy winter, right? Cold and flu season. If you missed any of this interview, you can go back and watch it again on kcal9.com. When you get there, just click on Seen on TV.